is very early data. This is interim. This is very preliminary, but we found that Rucaparib was #1, extremely well tolerated, especially compared to chemotherapy. Patients had grade 1 side effects primarily. We didn't have any DLTs. We did not have to hold any treatment for anybody. We dose reduced only 1 patient for grade 2 nausea. We saw no grade 3 or 4 events in this subset. The Rucaparib appears to be able to control the disease in this analysis, sometimes in a long-term way. We had 2 patients that are still on at the time of the analysis over a year, and an additional 8 that have been on for over 6 months at this time. And that it can, in some cases, continue to shrink the tumors. Just the Rucaparib alone, our response rate was 36.8%, which was surprising, given that these tumors are often already really squashed down with platinum chemotherapy. So we've currently enrolled 30 of our 42 patients, and our next steps are to finish that, obviously, to look at the correlative science that we have collected over that time, and kind of see where we land.